Hello and welcome back. I'm Kara Lee, and this is your weekly Brave Journey birth preparation videos where I pick a topic to talk about, all things related to birth and postpartum, and we talk about it. I'm a birth doula, a childbirth educator, and a childbirth preparation coach, and I'm currently building out my Brave Journey birth preparation program online course. It's not ready yet, so in the meantime, here are these free weekly videos. Today is the second in our series on newborn care, which is we're talking about newborn procedures done typically within the first few hours after birth. Last week we talked about skin to skin. I started with my favorite topic because I love talking about skin to skin because I have so many great memories of my own infants being placed skin to skin with me after they were born, and I love seeing it when I'm attending births as a doula. But today we're talking about cord clamping, which I don't get quite as excited about, but it's super important. There's really good data on how important waiting a minute or two to clamp the baby's umbilical cord is, and we're going to talk about that in a sec. If you'd like to receive these videos, weekly videos in your inbox, you can go to bravejourney.com and give me your email address. I don't spam, I just send these videos weekly, and I'll let you know when registration opens for my Brave Journey birth preparation program, online preparation program. So let's get to it. So when we're talking about cord clamping, what do we mean? As you know, when the baby is first born, so here is a baby in an amniotic sac in the uterus, and this is the placenta, and it's stuck to the side of the uterus. When the baby is born, they emerge, hopefully not feet first, but maybe breech. They emerge and they're still connected to the to the placenta via their umbilical cords. The placenta is still within the body and the infant is out. The question we're talking about now is when to clamp and cut that umbilical cord, and the growing evidence that indicates the importance of waiting a few minutes. So let's see, I've got some notes here I want to make sure that I have access to. The fact is that when the baby is, at any time during a term pregnancy, the infant has about 30% of their blood in the placenta and 30% going through their body. So it's kind of like it's a process of the blood moving through the placenta into the umbilical cord and into the baby. So when the baby is born, at any point, 30% of their blood is still in the placenta. So immediate clamping became really standard practice in the 60s. It was part of a whole sequence of managing that stage of birth by medical care providers. But recently, new evidence has come to light to indicate that the importance of receiving that full blood volume from the placenta. So funny enough, evidence-based birth, Rebecca Decker mentioned that medical care providers have been arguing about the timing of when to clamp the cord for about 200 years. She said that there's some recorded writings from the 1700s and 1800s discussing when to tie off the cord. So apparently, like many things in medicine, we're always learning. The question of whether to clamp the cord immediately or delay cord clamping is it's important. So delayed cord clamping is clamping the cord after the cord stops pulsating, so at least after 1 minute. Evidence does point to a full 5 minutes for all of the blood still in the placenta to get to the baby, but waiting at least 1 minute is considered beneficial in most of the studies. The truth is that not only is there growing evidence that it's beneficial to delay cord clamping, there's growing evidence that immediate cord clamping is in fact harmful, which is a different way of thinking about it. When cord clamping is delayed 1 to 5 minutes, infants receive more blood volume. That 30% that was in the placenta, they're going to get more of that the longer the delay is. They receive blood volume, which includes red blood cells and millions of stem cells as the blood from the placenta keeps pumping into the body, the baby's body. Delayed cord clamping increases blood volume in the baby. That boost of blood volume helps with transition. So at birth, the baby's transitioning so much. They're transitioning from a water environment to air, where they're feeling air on their skin for the first time. But most importantly, they're transitioning from receiving all of their blood oxygen from the umbilical cord to instead receiving it from their lungs. So that all is happening within those first few minutes after labor. The evidence-based birth mentions, Rebecca Decker mentioned that before birth, babies' lungs get about 10% of their blood supply, but after birth, they need about 50% of their blood supply to be in the lungs. So increased blood volume is going to mean more blood is available to the lungs to help with transition. The research shows that delayed cord clamping is beneficial not in those only in those immediate moments, but may also benefit longer term in promoting greater iron levels over the first few months. So research shows that infants with delayed cord clamping had higher hemoglobin levels at 24 to 48 hours. An acute metaphor from Rebecca Decker of evidence-based birth. She mentions that hemoglobin are like little school buses that drive oxygen around the body. It helped me understand. So low they drive oxygen and also iron levels. So low hemoglobin levels equals anemic. At 4 months, infants who received delayed cord clamping had higher iron levels and healthier myelin levels in their brain associated with motor, visual, and sensory processing. At 8 months, researchers found infants with delayed cord clamping had fewer cases of anemia, and at 12 months, they still had higher iron levels and lower levels of anemia if they had delayed cord clamping. So there's really strong evidence that it's not just the immediate benefits, but that the benefits can be up to a year. In addition, there's really strong evidence to support delayed cord clamping with preterm infants. This is very nearly inarguable. Delayed cord clamping for 60 seconds or longer really clearly decreases infant mortality rates in preterm infants. The data is very clear. All right, let's see. The effects of delayed cord clamping on babies at term is they have more blood volume because they get that blood from the placenta. They have improved cardiac function from blood flow into their lungs, improved hemoglobin levels for the first year of their life, and it may improve their long-term neurodevelopment. There is a small risk that increased blood volume may increase their risk of needing light therapy for jaundice, but as long as light therapy is available in our modern medical care system, if we're talking about people who have access to medical care, the benefits seem to outweigh the risks of that. Iron levels are important in infancy. Infants need iron to develop, and delayed cord clamping is a completely harmless process for birthing people. So it's just a matter of that blood is in the placenta. It's not going to go into the birthing person. So whether that blood is just lost or whether it goes into the infant, that's the question. So a delay of 2 minutes means they get some of their blood back from the placenta. A delay of 5 minutes means they'll get all of their blood back from the placenta. Delayed cord clamping is practical, it's feasible, there are no risks to the birthing person, so talk to your care provider. Delayed cord clamping can have a really big benefit on your infant, and ask about your care provider's routine newborn procedures just generally. Ask about what's available to you and what's done typically. And if you don't like the answers you get, go shopping and find a different medical care provider. Let me know what you think. Did you have any experience with delayed cord clamping? Did you request it? Was your request honored? Have you thought about cord clamping before? Do you find this topic interesting? Not interesting? I'm open. I loved hearing from you. I love hearing what you think. Thank you so much for listening. Next week, we'll continue our series on newborn care, and we'll be talking about eye ointment, the eye ointment that is often applied within the few hours of birth. So thank you very much.